Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. Tomorrow and Wednesday, we'll be briefing at 3 o'clock here in Victoria. On Thursday, we'll be issuing a statement at 3 o'clock, but there will also be a major briefing, including a technical briefing Friday morning with respect to modeling. That will be in the morning on Friday. The public briefing will be later, but there'll be a press technical briefing beforehand. With that, I'd like to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. Today's update covers the last 2 days here in British Columbia, so 2 time periods between April 11th and 12th, and then between April 12th to today. So we have sorry, I have to read my notes here. So between April 11th and 12th, we had 25 new people test positive for COVID-19 in BC. And then in the past 24 hours, we've had 20 new cases, bringing us to 45 new cases since our last briefing on Saturday. The total in British Columbia is now 1,490 people who've tested positive for COVID-19 in our province. That includes 650 in the Vancouver Coastal Health Region, 591 people in the Fraser Health Region, 87 people here on Vancouver Island, 136 in the Interior Health Region, and 26 in the Northern Health Region. We have no new long-term care facility outbreaks. That remains at 20. Mostly 11 in Fraser Health and 9 in Vancouver Coastal Health. We have had a number of new cases in those long-term care facilities, bringing our total to 254 people associated with long-term care facilities who have tested positive, including 159 residents and 97 staff people. In addition, we have a number of community outbreaks, as you're aware of. Primarily in the interior, we have the outbreak related to temporary foreign workers and a nursery. There's been one additional positive case in that outbreak, bringing the number of people who have tested positive to 20. The ongoing quarantine and isolation of all of the people in that community, and the Interior Health is working very closely with the owners and the property owners to make sure everybody is cared for and that they're able to self-isolate or quarantine effectively. In addition, we've had, as you're aware, one case identified at the Okanagan Correctional Centre. That outbreak remains under observation. As we know, there is a 14-day incubation period, so there is ongoing testing and surveillance being done at the Okanagan Correctional Facility, but to date, only one person has tested positive, and there have been a number of negative tests in that outbreak response. The other large outbreak response that we are dealing with, we talked a little bit about on Saturday at the Mission Federal Correctional Institute in the Fraser Valley. The outbreak continues to grow at that facility. We now have 35 people in the facility who have tested positive, including 8 who are now in hospital in the Fraser Health area. So this is, of course, of great concern to us, and we've been working very closely with Fraser Health, with Correctional Services Canada, and with the BC CDC to support the ongoing outbreak investigation, as well as the infection prevention and control measures that are needed within that facility. And our priority, of course, is to protect all of those who are in the facility, but ensure that British Columbians are protected as well, and that our community is able to respond and support people who are working in the facility, as well as the inmates in the facility and our hospital system. We are working very hard to ensure that the transmission within that facility will be contained. Unfortunately, as we talked about on Saturday, there was quite a lot of transmission that happened before the outbreak was recognized, and we are now seeing people who were exposed over the previous 2 weeks developing symptoms. And there's ongoing testing and surveillance that continues in that facility. In terms of our cases here in BC, we have 137 people who are hospitalized, and of those, 58 are in critical care or ICU here in British Columbia. Unfortunately, in the last 2 days, we've also seen a number of deaths increase. We've had a total of 11 new deaths to bring our total of people who have died from COVID-19 in BC to 69. The majority of those continue to be in long-term care, and our hearts go out to the families and the caregivers of the people who have passed away over the last few months, and the challenges that we know are facing the families across British Columbia. We have 905 people who have recovered fully from this disease in BC. One of the key things that we have implemented in British Columbia to ensure that we have ongoing protection of our communities and our families as we welcome our fellow British Columbians home from where they might be around the world is our requirement for approved self-isolation plans for all returning travelers. This came into effect on Friday, April 10th. And I'm really pleased with the initiative, and my thanks go out to the many people who are involved with supporting this. The success of this initiative is really to provide the necessary supports that enable our fellow British Columbians who are returning to self-isolate effectively, to make sure that they have what they need so that we can support them and they join us in making sure we're doing everything we can to stop transmission of this virus. So since April 10th, 1,701 people have returned from around the world to British Columbia. That includes either by vehicle or by air. And we have the support systems in place and have been fully activated. 13 travelers have required accommodation because they weren't able to immediately fulfill their self-isolation plan, and 207 people have been contacted to ensure that they have what they need in follow-up. So thank you to our many partners, the many public servants here in BC who stepped up to be part of this initiative, and our partners with the Quarantine Service and the Canadian Border Services Agency. This is an important ongoing initiative to ensure that we're doing everything we can to keep our communities and families safe here in BC. I also want to talk a little bit about personal protective equipment. As you know, this has been something we have been consumed with in the last few months to make sure that we have what we need. We continue to actively source and receive supplies of PPE for all of our healthcare workers, and we want to thank you particularly to our neighbours in Alberta for their additional supply that they provided to British Columbia over the last few days. That's fabulous. We have enough PPE to meet our current demand, but we are not out of the clear yet. Many of you have also made very generous donations, and we want to thank you for that. And but to remind people that the best way for you to donate or to offer your services and products is through the Supply Hub that has been established, and you can go to Supply Hub. And that is an important thing for us because we have a team of people who are able to make sure that anything that is donated meets the specifications that we need, particularly the medical specifications. Even N95 respirators are not all created equal. They are made for many different things, and some of them that are used in industrial settings may not be appropriate for the medical setting. So through the Supply Hub, we can make sure that these are all tested and they meet the specific specifications that we need to be used in the healthcare system. But we want to thank everybody for their ongoing efforts and contributions in this area. Finally, around weekend travel, we have asked British Columbians to avoid non-essential travel, and we have received many questions about BC ferries and about other travel options. I think it's safe to say that we have been united in keeping our firewall strong across this province. And BC Ferries continues to report more than 80% decline on travelers on all of their routes. So that is something that reassures us. But I do want to say there are many reasons why people may need to travel. And essential travel is still required to keep our province going, to make sure that we have the food, the medications, the things that we need in all parts of the province. Goods and the people to deliver our services still need to move. Many students as well are now returning home as the semesters have ended for our universities, and that is an important thing for them. I also know many people live and work in more than one location, and that means at the start and the end of their week, they may need to be on the road. But I thank you all for doing what you can to limit your need for travel. And everybody whose efforts to stay home and stay safe and keep a safe distance from others over this weekend. So today actually marks our 50th public update since this crisis began. And it's a key part of how we are trying to keep you informed and make sure that you know everything that we are doing, and that we all have the information that we need to take the actions to protect our families and our communities. And Minister Dix and I remain committed to maintaining these updates for as long as they are needed. It is so important for all of us to keep going with everything that we are doing now. It is holding us, it is holding our line, it is allowing us to deal with these issues in a way that is the best that we can do for our province. We'll keep going with our updates and with our 24/7 provincial response on this issue for as long as we need to do that. And I'm asking you as well to please keep on the line, hold that line, keep doing what you are doing. And especially for our youth and our young people and our children, remember, this is not forever, but it is for now, and what you're doing is making a difference. So thank you for doing your part with kindness and with care.
Thank you very much, Dr. Henry. I wanted to start by joining Dr. Henry in expressing condolences for the families and the friends and the caregivers of the 11 people who've passed away since Saturday from COVID-19 in BC. It is a huge loss for those families, for everyone involved, for the community of friends around people, and I think it's made particularly difficult by the circumstances of these times, where we're often not able to come together to grieve. So I wanted to pass on those condolences to all of the people affected, and I know all of those losses are felt profoundly by communities and by families. I wanted to note, Dr. Henry talked about the 1,490 cases, and the majority of which, of course, are recovered in BC now. We do have 137 people hospitalized, and those are 75 in Fraser Health. They represent the majority of the hospitalizations down in the province. It is by far our largest health authority, 37 in Vancouver Coastal Health, 12 on Vancouver Island, 10 in Interior Health, and 3 in the Northern Health Authority. And just to put it in context, we now have, as reported regularly, 4,844 vacant beds in BC. That means that overall the acute care system is at about 57% of capacity, and our critical care units are at 46.8% of capacity. I just want to briefly say what I think everyone understands, but sometimes we don't say explicitly, is that is an extraordinary, remarkable effort by people in the community, by primary care physicians and nurse practitioners and nurses and others, by all those involved in public health, that so many people have recovered in their homes with the support of public health, is a demonstration of where a huge part of the effort has been to fight COVID-19 and to help people recover when they get sick from COVID-19. I wanted to acknowledge that today, that you don't have that many people in the community who might regularly be in acute care without an extraordinary effort by everybody in the healthcare system. I wanted to just say a few things about PPE, that we, of course, are continuing to have success sourcing PPE from some traditional vendors, but also new international vendors, the federal government, and donations. I'd like to join Dr. Henry in expressing our appreciation for the generous offer from Alberta to share 250,000 N95 respirators with us. This is a great example of provinces working together to ensure that we don't find ourselves in critical situations. And as I've said before, our supply continues to arrive in amounts that's keeping us ahead of the need. And when we'd love to say we're in a position that we're flush for a long time, that is still no longer the case. We still have to work on this both on the supply side and ensuring that we use PPE properly. Over the weekend, the Saturday and Sunday, we had an example. For example, a shipment of PPE that arrived with 109,895 respirators, 51,000 face shields, and 1,200,000 gloves. More shipments are expected to arrive this week, but as is our pattern, we're not going to announce shipments until they arrive. I'd like to also reiterate that despite unprecedented international demand for PPE, BC is making sure that our acute care settings, but also long-term care and assisted living and other areas of the health system that need PPE to keep healthcare workers and residents and populations and patients safe, get those. We appreciate it that there are needs outside of those priority areas, and we're working hard to bolster our supply so we can continue to meet needs in the full spectrum of healthcare. And I'd also like to acknowledge, particularly in the Provincial Health Services Authority, but all of the health authorities, the work that's being done to sort and to assess and to test PPE that's coming from new sources to British Columbia, and make sure that every piece of PPE that comes into the province is safe and effective before it makes its way into the healthcare system. Clearly, we're very happy as well with the work that's happened at borders, at land borders and at airports, a lot of it led by BC public servants. We're very proud of their work, very proud of the fact that so many people who've come have now filled out, or all the people who've come have filled out self-isolation plans where they can, and where they can't, they're being assisted either to fulfill their self-isolation plan at their place, at their home, at their place of residence, or get assistance through receiving accommodation from the provincial government. We also want to thank our partners at the federal level for that. I think that change, which is, we're hopeful that will be followed up by other jurisdictions across the country, because people who return to British Columbia often do so through Toronto and through Montreal, that those measures will be taken up across the country soon. I want to acknowledge the work of Vancouver Coastal Health and Fraser Health in establishing new acute care surge capacity, both at the Vancouver Trade and Convention Centre, that's I think 271 beds, and at Royal Columbian Hospital at the new Phase 1 development at Royal Columbian Hospital, a further 80 beds. That work was done extraordinarily quickly, and I'm very proud of the work that's been done. And finally, just say about the weekend, we get information from BC Ferries and others, and just to put it in context, because I know that there's been a lot of discussion and a lot of frustration in communities about people who may appear at least to be traveling unnecessarily, and there's some concern about that. And undoubtedly there are cases where that's the case. However, I would like to note that on the major routes, according to BC Ferries, and this is information we've received from them that I think they're making available publicly, last year, 2019, on the major routes, which are the Schwartz Bay, Nanaimo, Tsawwassen routes, 173,284 people from Thursday to Sunday on Easter weekend. This year, 14,633, which is 92% less. On the Horseshoe Bay to Langdale route, last year 21,398, this year 3,911. The Southern Gulf Island routes, 23,349 to 3,342. Other minor routes, 42,904 to 8,908. I think one of the reasons, and having spent obviously time in my home this weekend in the Collingwood neighborhood of Vancouver, one of the reasons why I think there's a lot of focus on people who are not following the rules or seem not to be following social distancing rules or physical distancing rules is the extraordinary work that's being done by everybody. And I'm very proud of people in my neighborhood, in my community, and communities across BC who are doing extraordinary work. And of course, it's not perfect, and maybe it can't be perfect. At least it's not perfect yet. But I remain amazed and respectful at the same time of all those British Columbians who are sacrificing so much in this cause. It is humbling that our whole communities have been involved, and we have to stay that way. We have to stay 100% committed. We have to stay 100% all in Our path is as clear as that achievement of what we see in our communities now. We have to bend the curve, not the rules. We need to follow the rules and flatten the curve. Continuing to meet this challenge will see us through the weeks and months ahead. Bend the curve, not the rules. Follow the rules, flatten the curve. And with that, we're happy to take your questions.
Okay.
Is that on the questions?
Okay, so we'll move into the questions portion now. Just as a reminder, please press *1 to enter the queue. You are limited to one question, and I would ask that you please unmute your phones. You will not be audible until I call your name. First question today is from Richard Zussman, Global News. Go ahead, Richard.
Minister Dix, you mentioned following the rules, and this is for both you and Dr. Henry. There's been a video posted online, I'm not sure if you've seen it in Vancouver, that's been viewed more than 1.7 million times. Are you, and advocating for breaking those rules and going outside and enjoying the sunshine. Do videos like this concern you that the message will resonate with people and people will watch this and say, hey, how about I go out and break these rules as well?
Yeah. I'll start by saying, you know, I think there's lots of really great videos out there, including a certain cooking show that I was amused to watch. And I think it reflects that people are paying attention, and they may be looking at videos that tell them to break the rules because of concern, and I get a lot of emails about it. But I think if we look, and I look in my neighborhood, we look at places around the province, the vast majority of people are doing what we need them to do. I do think it is important for us to go outside. I think it's important for our mental health as well as our physical health and our family health. So I encourage people to go outside, but to do it in a way that maintains that distance. We know this virus can't magically jump between people. So when you are outside, if you have that distance between you, you're being safe. And I have seen many, many examples of people who are having a conversation with their neighbors from a safe distance. And we can't lose that important connection that we have. People are out with their family, with their housemates, having picnics, sitting in the sun, going for a walk. Those are fine. It is the gathering together inside that we know this is most likely to be transmitted. And I'm really grateful that most people are following the rules.
Yeah, Richard, someone told me about this, and I think, you know, I think we've seen in the past number of weeks one or two examples of people behaving very badly, and that may be inevitable in these times, that people are attempting to essentially promote themselves. And what I think genuinely, if you look in any depth at their other views, are marginal views. And I think what I'd say to people is focus on what we need to do together, and don't allow people who are attempting to promote themselves by using the suffering of others to distract us. Don't promote them, don't look at them, but focus on what we need to do together.
Next question comes from Gordon Hoekstra, Vancouver Sun.
Well, good afternoon. Dr. Henry, I know a couple of weeks ago, I think you said that you hadn't entirely given up hope about a reprieve, partial reprieve from the summer, you know, with influenza, you know, if the virus acts like influenza to some extent, and that you'd be keeping an eye on, you know, countries like Australia and New Zealand. What's your thought about that today?
Yeah, it's really challenging to tell. We're now seeing in some, in New Zealand, Australia, slightly increases. We're at that transition zone right now where we have seen influenza fall away here. People are still early into the influenza season in the Southern Hemisphere. So I really can't tell yet. And it's discussions we're having with those who know way more than me about respiratory viruses around the world. I think that the challenge we have is this is such a new virus and there's so little immunity to it that it may still continue at a lower level, even if it wanes somewhat with the warmer weather. So I think it can't hurt us. It may be helping us, particularly over the coming weeks. We'll see that.
Next question is from Kat Slepian, Black Press. Kat, are you there?
Ordering any of the new... Hello, yeah?
Okay.
Hello?
Go ahead.
Sorry. As for Dr. Henry or I guess Minister Dix, curious whether or not BC is going to be ordering any of the new rapid tests developed by a company out of Ottawa, and if not, why not? And if so, how many?
Yeah, so the new Spartan test that we're just, or the new test developed by Spartan, so it's a NAT test, we call it a nucleic acid test, which tests for the the RNA, in this case, of the virus that we're looking at. So we do have, our labs are doing that type of test already in British Columbia, so it is a nucleic acid test that we do at our BC CDC lab, and we now have, as you know, our 7 linked labs in British Columbia. We have also been focusing on a more rapid test that we can deploy to some of the areas where we have challenges with transporting specimens back and forth. So it's a very similar type of thing to the Spartan machine. And it's one that uses a gene expert, which is a machine that we happen to have some of in British Columbia. So our strategy right now is to deploy those to areas of the province where we're having challenges with turnaround time around testing. And that has been rolled out over the next week or so. So this new test has very low capacity as well, so that you can't do a whole lot at once. So it is also good for these types of things where more remote communities where you can do it within a fairly short turnaround time. But right now we have an already proven machine that can do that, and the tests available to do that we're deploying. The other thing that we understand from the Spartan tests is the initial ones are also already spoken for, so it wouldn't be until later in the summer that they'd be available. So we're focusing right now on the deployment of the ones, the tests that we have in hand over the coming weeks. But of course we'll be watching and seeing where these might be of value for us once they become more available later on in the summer. And the other thing around testing, of course, that we're really focused on is how we can supplement our understanding of this pandemic in British Columbia with serology testing. And I'm very excited to know that that's going to be coming online hopefully in the coming week, 10 days. And our strategy, and we'll talk more about this later this week, about how we can use serology to better understand the pandemic so far and how we can use it to support our measures going forward. So those are the 2 areas that we're working on right now.
Okay, next question is from Les Lane, Times Colonist.
Dr. Henry, you co-authored a paper 9 years ago, Social Distancing as a Pandemic Influenza Prevention Measure. And to sum it up as briefly as possible, you reviewed a lot of scientific studies from around the world, and I think you raised some questions about the empirical evidence that shutdowns have an impact, particularly school closures. I don't know if you recall that piece offhand, but I was just wondering if you could discuss it.
Sure. Yeah, so that is, as I've said, I've been involved in thinking about these types of things for a number of years, including on a WHO technical advisory group on our Canadian Pandemic Influenza Planning Committee, which I've chaired for a number of years. And that paper came out of our experience with H1N1 in particular around the world. And there was a lot of discussion internationally and nationally about whether school closures made a difference in the trajectory of that pandemic. And my concern, a lot of it is based on modeling. And of course, as you've heard me say many times, modeling has its challenges. It helps in understanding some aspects of what could be expected, but none of them are perfect and none of them are right. They're not predictive. So in that paper, my concerns were really about balancing the impacts, particularly of school closures. And this was a focus that we had been looking at. So I'm only one of the authors of it, that we had been looking at a long time. And it is reflected on how we're managing with our schools here in BC now. We know that if you have school closures, for them to be particularly effective in an influenza pandemic, it needs to be for a fairly lengthy period of time. We're seeing that as well with coronavirus. And we know that there are some people that are more disadvantaged during a school closure than others, particularly students who have a chaotic home life, who may have challenges with food security in their home life, may have issues with being able to access online resources, for example. And we know that children who are falling behind, when we have prolonged school closures, they may never catch up in their lifetime, and that has effects on their health and on the health of their families going forward for many generations. So the point of that paper was saying we needed to understand how we could do school closures to minimize transmission risk, but still support those most in need in our communities and those children who are most in need so that they don't fall behind so much. And that is one of the things that we've been working very hard with the Ministry of Education here in British Columbia to ensure that we reach out to those families where students have more needs, where the school lunch programs, for example, may be one of the most important meals of the day for many children and many families across the province. And there's been some really great initiatives in the school districts around the province to support those children and those families. So that was the focus of the paper for me, was really about recognizing the unintended consequences of prolonged school closures and making sure that if we did them, if they were the thing that needed to be done, as in this case, that we did them in a way that supported the most disadvantaged.
Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. I wonder if there's any explanation why the Fraser Health Authority has more people in hospital than all the other health authorities combined. I know it's the most populated, but is there something going on there that's not going on elsewhere?
I think there's a couple of things. Some of it is related to where the outbreaks were in Fraser Health. And particular now, we know that at least 8 of the hospitalized patients are related to the Mission Correctional Facility. So yes, it's a little bit of the population affected, who many of the earlier travel-related cases, for example, and where people are living. So there's nothing particularly different. One of the things in Vancouver Coastal that has led to perhaps a lower hospitalization rate has been that many of the cases have been in long-term care, and people have been staying in their residence in long-term care rather than being transferred to hospitals.
Next question is from Binder Sudjan, CTV.
Hi, Dr. Henry.
Sorry.
Can I just say I will be presenting some more data later this week along with our modeling around the demographics and the epidemiology of who has been affected by this virus. What are the age ranges? What are the locations, the types of epidemiologic information that will help you get a better picture of who exactly has been affected. So sorry about that.
Okay. Go ahead, Binder.
Thank you. Sorry, Dr. Henry. So I just wanted to ask you, at the federal level, there's been a lot of talk about outbreaks at long-term care facilities. And BC introduced stricter measures about a month ago. And I know today you're talking about more cases at some of those facilities. Can you talk a little bit about why you think we continue to see those, and if it's possible to fully restrict the number of cases that are coming out of those facilities? And also wondering if you can just clarify, out of the 20 cases, does that include South Granville Park Lodge, where we are hearing there's another cluster of cases?
So a couple of things. As you're aware, one of our first outbreaks was the Lynn Valley Care Centre, and it was one of the first cases that we had here in British Columbia. So we recognized very early on that as soon as there are cases in residents in a care facility, that's an indication that there's been transmission that we may not have recognized for some time. And with all of these outbreaks with this virus, once you get behind and are playing catch up, it's very challenging. We're seeing that in the Mission Correctional Facility as well. So there are a number of the long-term care facility outbreaks where several cases were identified. And then, of course, once you identify a case, you know that there's people who have been exposed. And we have to wait the 2 weeks incubation period to understand who's actually going to develop this disease. We've also been learning about this virus over the time that the outbreaks started. We know that particularly in elderly people, they can have extremely mild symptoms, and that's why we're have expanded the testing in long-term care facilities to make sure that even people who are asymptomatic or have very minimal symptoms who have been exposed are tested and are isolated if need be. So it is incredibly challenging once you start having an outbreak, when there's been transmission, understanding who's been exposed and who hasn't, and then when they develop disease, even recognizing it in some people, either elderly people who may have very mild symptoms, or young healthy people, most of our healthcare workers, who also may have very mild symptoms. So it has been a challenge, and we're seeing that across the country and around the world, where we have vulnerable populations who are in those types of settings where they're congregate settings, whether it's a correctional facility, whether it's the nursery where the temporary foreign workers are living in conditions where they're close together, whether it's a cruise ship. So it's very challenging. We put in very strict measures early on, reducing visitors, and that itself has its impact in long-term care. When older people who may have dementia or other needs aren't getting the physical contact that they need and the contact with their families that they need, that can hasten people's decline as well. So it is, we recognize this very early. We're trying to do as much as we can to protect those environments, and it's been very, very challenging. I think made even more challenging several weeks ago by our paucity of personal protective equipment for many of those settings. We are in a much better place now. We are in a much better place with not having healthcare workers in long-term care moving around, although that has taken some time to sort out because it's such a complicated issue. But as we're seeing with the continuing tragedies in those care homes, once the virus is introduced into those environments, it's very, very challenging to manage.
Next question is from Marcella Bernardo, News 1130.
I guess this is for Dr. Henry. Thank you for taking my question, but at what point are you going to start cracking down on defiant wingnuts who claim their rights are being violated during a state of emergency and ordering beaches to shut down?
Yeah, you know, we've said this before, and I think that there are, as Minister Dix said, you know, there are some people who are trying to make their name for themselves, to do things that they think are defiant, but we know that most people are following the rules. And that is making a difference. And we know that most people who are floating things are trying to, you may not appreciate the issues that are going on. So I don't, you know, I believe that we are doing the right things, and the vast majority of people are doing the right things, and that we need to give people the understanding and the means to do the right things. So rather than closing down beaches, I think we need to ensure that people are aware of the rules. We need to step up some of the enforcement of those rules, and we have bylaw officers in all of our communities now who are able to do that. And we need to put in measures that make it less easy for people to flaunt the rules, if you will. So things, simple things like closing some of the parks to vehicular traffic so that there's more ability for people to have space, and making sure that the beaches are able to support people being with their families and being outside and not mingling with others. And quite frankly, when I go out and see the beach and when I go to the park on my runs, I see most people are doing the right thing.
Next question is from Eva Yuguen from CBC. Go ahead, please.
Hi, Dr. Henry. You mentioned we might be playing catch-up in some of the outbreaks at long-term care centers. In order to try to get ahead of the outbreak at South Granville Park Lodge in particular, shouldn't all the healthcare workers and residents there now be tested for COVID-19?
So what we are trying to do for all of the outbreaks that we have and for all long-term care facility is put in those preventive measures. And part of the important part of the preventive measures is assessing healthcare workers every day for screening for symptoms, screening residents on sometimes several times a day for symptoms, wearing a personal protective equipment for all of the interactions. The testing, unfortunately, doesn't tell us the whole story. People can be negative 1 minute and positive within an hour. The test itself is not as sensitive as we expected it to be at the beginning. So we now know that about the false negative rate can be as high as 30% early on in infection. So we still, the norm is not to test people who do not have symptoms, because we know the test doesn't perform very well and we can have false negatives. Having said that, when we do have outbreaks and we do recognize that people have symptoms in a care home, then we have a very low threshold for testing anybody to make sure that we can try and get ahead of it as best we can. So the testing strategy, as I've talked about, has evolved, and it's evolved around our management in long-term care homes as well.
So we have time for one more question. As a reminder, for any reporters that didn't get to ask a question, there will be a statement released later this afternoon with all the information covered off. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Our last question is from Ben Nesbitt, Check News. Go ahead, please.
Hi, Dr. To see some other countries begin to lift restrictions and attempt to begin a path back to a normal life. I'm just wondering what you would need to see here in BC to seriously consider starting that process of returning to normalcy, and what restrictions would be lifted first when that happens?
I don't have those answers for you yet. Just to say, there's a whole variety of things we're looking at. And part of it is the context that we're in, both in Canada and in North America. That's important. So we need to be cognizant of what's happening across the country and in our jurisdictions that are around us, because that affects us as well. So things like putting in our border measures are really important. Recognizing that we're at the same place as our neighbors in Alberta, across the prairies, what we're looking at in Ontario and Quebec as well. So those are some things, what's happening around us. We'll be looking at what's happening in BC, where the outbreaks are, how much we're doing testing in the community, our ability to detect outbreaks, but also in some of the modeling will help you understand, or help us understand this, what are the signs that we're starting to see increases again. And then we'll be looking at what are the things that are most relevant to get going in our communities and in our healthcare sector. So there's two sort of different things that we're looking at right now. What are the things that we need to get our economy, our communities, getting people going, and what are the things we need to do in our healthcare sector that we can manage so that we can take care of increased numbers of COVID-19 should we start to see them without compromising the rest of the care system. So it's complicated, and we of course are watching what people are doing in other countries where they're trying to take off restrictions to see if there's ones that we want to stop with. I will say that the basics, the hand hygiene, the safe distancing, the making sure that our workplaces are able to have the enhanced cleaning, the safe distancing, the working from home, those are things that are not going to change for a while. Those are things we're going to have to be continuously thinking about doing for the next coming months, until we have enough herd immunity that we're not going to get a dramatic increases and rapidly increasing infections in our communities. We're also looking very much at the public health system and how do we support the ongoing testing and contact tracing that's needed to help us keep an understanding of where things are happening in the community. So it is complex, and there's lots of very wise people with way more expertise in this area than me that are looking at this over the last coming weeks, and we'll be describing some of this in more detail later this week.
En français?
Juste en français. Juste pour dire que depuis samedi, on a eu 11 morts de plus de COVID-19 en Colombie-Britannique. Bien entendu, on envoie nos condoléances à tous ceux qui ont perdu un proche, que ce soit un ami ou un membre de sa famille. C'est bien entendu un week-end douloureux pour eux et pour nous. Il y a 1490 cas en Colombie-Britannique, 45 de plus depuis samedi, donc 2 jours, donc 25 de samedi à dimanche et puis 20 de dimanche à lundi. Nous avons aussi 137 personnes qui sont hospitalisées en Colombie-Britannique, ce qui est à peu près la même que la semaine dernière. Donc, la majorité de ces gens-là sont dans la région de santé de Fraser et il y a bien entendu une situation très sérieuse aux prisons à Mission qui a un effet sur ces normes, bien entendu, mais qui demande le défi qui reste devant nous pour nous adresser à ce problème, cette crise d'urgence dans notre système de santé et dans notre société. Donc, merci beaucoup. Thank you very much, and we'll see you tomorrow.